Hello, everyone. We're going to let everyone get in. We'll ask that you mute yourself as you enter.
This meeting is recorded.
Hello, we're so glad that everyone can join us today. My name is Danielle Fuentes Johnson, and I'm with the Build Initiative. Welcome to the next in Build Initiative's home-based childcare webinar series, leveraging federal funds to support home-based childcare. Today, if we can go to the next slide, we'll take a quick look at the agenda, but as we do that, we're going to launch a poll just to see who's with us today. And feel free to introduce yourself in the chat as we let everyone get settled in. Once we have our welcome today, we're going to invite Simon Workman to present an overview of the federal funding and the unprecedented opportunity that it presents for home-based childcare right now. Next, we will invite Lanet Dumas, Executive Director of NAFCC, to discuss some of the approaches states and communities are taking to using or planning to use these funds. At which point we will also go into some breakout groups to discuss a little bit more in depth what you're thinking, what you're wondering, and how you may be planning to use the funds in your location. All right. With that, we're going to go ahead and end the poll. And as always, our series is based in our core beliefs, and I will turn it over to Gina Capito to review those with us and take us to the next steps.
Hi, everyone. Great to see you. We're thrilled that so many folks could join us for this extra webinar. We usually are together every other month where we're diving into timely issues related to home-based childcare, answering areas that you've brought up as things that you need or want to hear more about or want to talk to each other more about as a network. And so today's topic, focusing on the federal relief funds, is really no different. Just a note on the poll, we've got about 54% of you represent support organizations, coaching, quality support, technical assistance staff, those sorts of roles. And we have actually a smaller group of educators than we usually have today, home-based educators, but a larger group of system administrators. So welcome everyone. And then lots of other write-in actually as well, 22%. So please don't hesitate to take a moment to fill in what your role is in the chat, as well as just introduce yourself, where you're coming from, what state you're coming from, as we continue to build this network of family childcare supports for one another. At the start of all of our webinars, we touch base on our core beliefs. And so given the topic, which is federal relief funds and how do we, as we continue to try and ensure authentic voice for family childcare in all aspects of the early care and education system in states, it's even more timely. And we talked about it during last month's webinar as well, this unprecedented investment in childcare that we have right now and the opportunity to really ensure that we are thinking about long-term what we want our childcare systems to look like and how we're leveraging this funding to support us in that effort. Looks like we just lost Jonathan, our screen sharer. So if you don't mind, just one second, I'll get our slides up. Oh, he's back. All right. So moving on to take a quick look at the core beliefs, you'll notice that the nature of today's content really does cut across all of the core beliefs. Obviously, there is a heavy emphasis on the idea of resourcing family childcare and home-based childcare settings on par with center and school-based. That's number 2 of the core beliefs. And so we really believe that understanding the federal funding that's available, and that's why Simon Workman's joining us today to give us a little overview of that, and then thinking about opportunities as well as thinking about what other states have done in this area. Lanet Dumas with National Association of Family Childcare is going to share some of those strategies with us so that we can make sure that we're all in the right headspace to be thinking about how we are ensuring authentic voice and that family childcare settings are really well represented in the conversations and in how states are thinking about using these dollars, and that we're not in any instances that family childcare or home-based childcare is not being overlooked. So with that, I'm going to turn it over to Simon Workman. Simon's joining us from Prenatal to 5 Fiscal Strategies, and he's going to give us a high-level overview of the federal funding.
Thanks, Gina, and hi, everyone. Good to be with you this afternoon. As Gina mentioned, I'm Simon Workman with Prenatal to 5 Fiscal Strategies. We're an initiative that is focused on really helping states and communities with a lot of fiscal work around early childhood, understanding how much money is needed to achieve your goals and how funding policies really intersect with governance and finance, and really promoting a comprehensive approach to addressing financing issues, really to promote the big systems change that we all need. And so, a lot of that requires a lot more money. And so, it is great to see this sort of unprecedented opportunity that we have ahead of us right now, with a lot more money coming into the childcare system and the early childhood system writ large, partly as a result of COVID, but also as a result of a deeper recognition of the needs of this field and the importance of this field. So if we go to the next slide, and the next one. So I just wanted to give you a very quick overview about the American Rescue Plan and how much money is available, and some of the significant new investments that are available in the American Rescue Plan that was passed by Congress back in March. And this is, a lot of the conversation right now has been about additional money coming through under reconciliation, and those conversations are ongoing in Congress at the moment. And there's potentially, very, very significant money in the range of, $200 billion, sorry, for childcare in that package, plus more money for pre-K. But right now, looking at the money that has actually been passed by Congress and is available, is the American Rescue Plan money. And what you see here, just looking through these numbers, is these are big numbers. These are numbers with a B on them for billion, whereas in the past they may have been an M with million, right? So two big ones, the childcare stabilization grants at 24 billion and 15 billion additional supplemental funds for the childcare development block grant. There's also money in the bill for Head Start grantees, for McVie. And then there is money in the other three I put at the bottom here are the Governor's Emergency Education Relief Fund, and then the Elementary and Secondary School Emergency Relief Fund, and the State and Local Fiscal Recovery Fund. Lots of words, lots of acronyms. But this money isn't necessarily, is not only for childcare, but is money that can be used for childcare, right? So the governor's money, that 4 billion there is flexibility there in how they spend that money. The ESSA money that's targeted at elementary and secondary school relief, the wording about how that money can be used does allow it to be used for elements of early childhood. And same with the state and local fiscal recovery fund. State and localities and communities have a lot of discretion about how they spend that money. So it's important, as we're thinking about what money is available to support the significant needs we have right now in this sector, that it isn't just the 39 billion that comes from the stabilization grants and the childcare development block grants. There is other money available out there. And Bill just put out a paper recently going through some of these main funding streams. I know the Children's Funding Project also put out some data around that, and I know Kylie's on the call today. And so, there is more details about all of these. I'm not going to go into today, but you can find out more details about them, and I know some links are going in the chat right now. I just wanted to mention the obligation deadline. So this is kind of where some of it gets a bit complicated by when states have to spend the money by versus when they have to sort of obligate the money. The important thing to know here is that while there is a need to get this money out sooner rather than later, and there's a big push to get the money out soon to sort of really, especially on the stabilization grants, to help providers who are struggling right now due to COVID and due to the pandemic and the economic recovery from there. We actually do have some time, especially on the CCDBG supplemental funds. They have to be obligated by 2023, and then you've got a year to spend them. So, while there is a need to get things out there soon, there is also the time for states and communities to take a step back and say, how are we really using this money? Let's make sure we're using it in a way that is going to lead to the real change that we need in this system, and that it is not just kind of going into, there's a lot of problems with the market-based early childhood system, and we don't want to kind of exacerbate those. We want to remediate those. And so taking the time to really plan and be thoughtful and collect stakeholder input is really key. So on the next slide, I'm just sharing a graphic that the Office of Childcare put out that you may have seen before, but just to kind of situate the American Rescue Plan, the ARP, the orange circle there, in what came before. That we had the CARES Act back now in March 2020, back early days of this period we're in, and then you had Cursor in December, which put additional money in, and then the American Rescue Plan in March of this year. And the big thing to see here is obviously the American Rescue Plan is a much bigger investment compared to the other two, but also it has a lot more flexibility, and as we'll see in just a moment, some of the money can be used, or a lot of the money can be used for things that are not explicitly about COVID-19, right? Whereas for CARES, it was very much, COVID-19 related expenses. There is a recognition right now that this system needs more money writ large, so there's a bit more flexibility in the funding. So let's look at those two main funding streams in the American Rescue Plan on the next slide. So the main ones you've probably heard about, and you're probably thinking about how to access or to support providers in your network to access. The stabilization grants, these, the majority of the money here, and this is the $24 billion, so a lot of money there. The majority of it has to be spent directly as sub-grants to providers. States can keep 10% as for sort of overhead and sort of doing all the administration of them. But that's a lot of money going directly to providers and sub-grants. And importantly, it's available to licensed, regulated, or registered under state law. So the federal guidance is not saying, what we deem as a licensed, home-based provider, for instance. That is up to however the state law is terming someone as licensed, regulated, or registered. And I know like every state is slightly different how they kind of name family childcare providers, home-based providers. So I think that's particularly important for this audience. And also knowing even if a provider is closed right now, if they are closed temporarily because of COVID, and the intention is to reopen, then they can still access those funds. And importantly, the subgrant amounts are meant to be based on current operating expenses. So they're really intended to support the operations of a program over the life of the subgrant. So, anybody who has heard me speak before, talk a lot about the difference between price and cost. I'm not going to get into that today. I could talk for hours, but the important thing is they are not saying the grant is based on the reimbursement rate at the moment. They are saying it is based on the what is your current operating expenses, and there are lots of different ways that states are estimating those current operating expenses. Importantly for home-based childcare is to think about when we talk about current operating expenses, that should include compensation for home-based care providers as the lead educator, as the provider, as the owner. Even if that is not built into your rate, we encourage people strongly to include that into their operating expenses so they're being adequately compensated in these stabilization grants. The other big one, the 15 billion, is the CCDBG supplemental funds. These are exempt from some of the regular CCDF spending requirements around quality activities and direct services. And they can be used for any allowable use of funds under CCDF, so not limited only to expenses related to COVID-19. And there's really this kind of push in here to use the money to strengthen the system and ensure families have equal access. And so, there's some really key pieces here that get called out in the guidance. And on the next slide, I just kind of pulled some of them out to quickly show you and we can drop in a link into the chat, some more of the details on here. But if you look through this kind of federal guidance on the supplemental funding, increasing payment rates. So you're actually paying on the cost of quality, not based on the market rate. Improving payment policies, increasing the use of grants and contracts, paying on enrollment, not attendance, paying higher compensation, building the supply, and they especially call it out for infants and toddlers during non-traditional work hours and in rural communities. 3 key areas where home-based childcare provide a lot of the care for these 3 underserved populations. And also then investing in data systems and outreach and mental health supports, very important things. And so on the next slide, as I look at this and kind of what I leave you with today is, looking at there are opportunities here. There are significant opportunities here. It is key for home-based childcare to be having a seat at the table in all the conversations about how the money is spent. But, when I look at this, it's both the compensation for home-based childcare providers, making sure that is built into cost modeling so that when grants are set, it includes compensation for home-based providers. Thinking about what is the way to increase home-based childcare providers supply, how can we be investing in networks or other supports to help home-based childcare providers provide that supply for infants and toddlers, rural areas, and outside of the traditional workday. And then also thinking about how can home-based childcare providers be a really key part of the early childhood system, so that when we are looking at data, it's inclusive of home-based providers. When we're looking at, all the system supports that are out there, that they are not, home-based providers are not an add-on, they are a key integral part of it. And that really then points to the long-term opportunity here to say, if we're going to serve all the kids that need serving, if we're going to meet families' needs, that requires, incorporating all types of providers. Centers and school-based programs are not the only ones that have a monopoly on quality. There's a lot of different types of quality providers out there, and there is an opportunity with this money to really build up the robust systems to make sure that all types of providers are included in this kind of both the rebuilding effort that we're at right now with stabilization, but also then laying the groundwork for any future significant federal funding to to make sure that this is a robust system that includes all types of providers. So with that, I'm going to pass it on to Lynette Dumas to talk through, I think, some examples of how some states are actually implementing these funding.
Simon and Lynette, one sec. We actually had a comment in the chat from Massachusetts, and I just wanted to encourage Jennifer Cormier to share on that. We'll be talking a little bit more about MA when Lynette's speaking, but I thought maybe if you wanted to share directly, you're welcome to. Tell us a little more about that. And you're all able to unmute yourselves. We're not controlling you in that way.
Hi, good morning. So Massachusetts has decided that they will not allow stabilization grants to go to programs that are closed still due to COVID.
Okay.
And so I'm just wondering what the options might be to get that clarified for the state, or how we could go about reaching out to people who might be able to help those providers get the funding.
Yeah, let me look into that. I would have to check whether it's, I know they definitely made it that it could go to licensed providers, but I don't know whether the guidance, I'm assuming the guidance must allow the states the flexibility to not do that if Massachusetts is doing that, but it's maybe worth checking and clarifying the guidance. I can take a look at that while Lynette is presenting.
And we may be able to share up a couple examples of states where they have chosen to make those grants to closed providers in order to, that might help you, Jennifer, in talking to your state leaders.
Yeah.
Thank you.
Hi.
So
I was waiting for a slide to say, hi, so I'm Alana Dumas. I'm the Executive Director at NAFCC. I've had the pleasure of joining you on many of these calls, so I'm happy to be back with you. Thank you, Simon, for lifting up the opportunity to support the true cost of quality care in home-based settings, and how states can actually work with the federal guidance to actually impact the lives of the children and families served by home-based providers. Can we switch to the next slide, please? I think the last time that we talked about how to actually center providers' voice and genuinely engage providers. And I shared that in working with family child care educators across the country, these are values that reflect the build core values, but they're actually the words that come from family child care educators across the country about how they want to be perceived and included in systems. And I think as we're talking about how we translate the federal guidelines and federal dollars into state and local action, I think it's always important to center it in the true and genuine voice of family child care providers. So I wanted to share those values one more time with you as we talk about how states are using the dollars. Can we switch to the next slide, please? So it is important, as Simon pointed out, that there is this huge opportunity to look at the system in a very different way. I think we have been very used to how we are going to divide up the crumbs. So if you saw the slide that Simon shared earlier and saw that we've had large investments and we now have an opportunity for an even bigger investment. And I know that Gina likes me to stay in the reality, but I am right now still have the opportunity for the hope. And right now is that we can still go big for childcare in general, including family childcare. And there's still an opportunity for us to make this historic investment, which could potentially be 30 times the investment that we've ever had, which means that we can build a system, a strong system that providers and families want to be a part of so that we can impact quality care, school readiness, and lifelong success for children and families. So we know that there's a potential of having dollars that will have an inclusive system for not only childcare, but public pre-K, which would, and the language right now in the House, we don't know what the Senate's going to say, actually includes, it says a system, a mixed, certified delivery system that includes childcare, family childcare, Head Start, and school-based. So I want us to keep that in mind as we move forward with how we're thinking about how the rubber meets the road with states. Can I have the next slide, please? Jonathan, could I have the next slide, please? Thank you. So I want to lift up a couple of examples. And so Jennifer, thank you for mentioning Massachusetts. We actually have seen some good things happening in Connecticut and Massachusetts of how they're collecting data to actually deliver the dollars in a more equitable way. So they're using census tract data to inform how they deliver grant dollars and potentially in the future subsidy dollars to actually cover those gaps. And I think a lot of times when we're talking about equity, we're throwing that word around a lot lately. Equity, but equity is actually giving more where folks need more and less where folks need less. And so I really really applaud the idea of looking at census tract data to inform, in addition to true cost of care data that Simon was mentioning when he was just talking a few minutes ago. The other thing that these states have invested in is professional membership. So they are supporting based on feedback that they've received from providers in their systems that they're paying for professional memberships and networks and supporting networks for family child care. In Louisiana, my home state, which sometimes lags behind, so I'm very excited for this. They are have actually used their ARPA dollars to determine the true cost of care in center and family child care settings, and they surprise, they found out that the cost per child is more in a family child care setting. And so I know there's been a lot of myths, and if we look at market rate surveys and how things are paid, there tends to be a lower payment for family child care settings. So I'm really excited that they are actually looking at this and seeing that, wow, the data shows us when we use our cost model and they use Simon's cost model, and they can see that there is it does cost more per child to deliver care in a family child care. And I think that is game changing as we think about how we're going to people in the future that we
I had a quick question.
Yes, ma'am, Colette. Okay, I'm sorry. So we want to pay people a dignified wage that includes, Eric, I'm going to have to, I will look it up before we're off this call. I will get you the amount because I have it written on another piece of paper. No problem. I think that is, again, game changing. We're talking about dignified wages, benefits, including insurance, health insurance, mental health, paid time off, retirement planning. So I'm just very excited. Also, they determine the true cost of care by actually engaging family child care providers in the cost for their operation. So it's something to consider. Again, excited to lift up Louisiana of being leading in this space. Another state that I think has done some good things with their recovery funds, and not only all the states have these supplemental grants that their stabilization grants that they have to deliver. Texas gave the grants to registered and licensed family child care providers. We know all the states have different ways of how they regulate the setting. So I think the average grants for registered providers was about $6,500. And for licensed providers, it was a little under $7,000 total grant amount, which felt good to the providers at the time. But listen to Simon lifting up the fact that it's supposed to help for the duration, then you wonder how much, if you're looking at the true cost of care, how much time is $6,000, $6,500 or $7,000 for the operation of a family home-based program. The next thing that they did that I do appreciate is business coaching. So the Texas Workforce Commission is using their recovery dollars, 15 million of their recovery dollars, to provide childcare business coaching and childcare to childcare centers and home-based childcare, but the coaches will be coaching specific to the setting. So right fit, you've heard me talk, I've said this all the time, it has to be relevant to the home-based setting. It's not just a mini center or a mini school. And so I love the fact that they're using business coaches specific to home-based settings. And again, that's the Workforce Commission. So not your typical players that are supporting the family child care providers. So it's so important to think about who are the other folks that have these ARPA dollars that can be impactful for family child care businesses. And then one other state that is not on my slide is Vermont, who also had stakeholder input into how they're using the ARPA dollars. And so two of the things that are pretty exciting is, again, business supports and technical assistance, and also capacity building, especially around social, emotional, mental health, and other training specific for family child care. So those are some seeds, some food for thought about how we can think differently about creating an inclusive system, a supportive system that families and providers want to be a part of. And I look forward to our conversations when we move into the breakout sessions and able to talk about it a little bit more.
Before we do go to breakouts, there's been a little bit of chatter in the chat about shared service models and alliances as one of the ways to implement relief dollars. So I wanted to see, I know we have lots of folks that have different levels of engagement in this in their own states. So if anyone wants to jump in and talk about what you know your state's doing around that, I think it'd be great. I did note that we'd follow up with resources, but while we're all together.
Yes, and I'm sorry because one of my notes that I totally didn't do. Talk about, I was supposed to talk about staff networks and associations. So I'm happy to jump in after folks share their experiences.
Okay, well, let's hang on and see if anyone wants to jump
Pamela,
in.
go ahead and unmute. You have your hand raised.
Did you say Pamela?
I did.
Okay.
Welcome.
Thank you. I had to step in here. And I'm from Illinois. So in Illinois, they took the respirational, they called it the respirational grant from the, what was it, the rescue plan. And they provided licensed providers with might as well say it was about a year stipend, because you got it every 3 months. And also centers. And one thing that they did look at, they did take the input of childcare providers as well to see how with the other money that they got, was it like the bailout money or something? They're using that to restructure our subsidy program. They want to make sure that they don't just give out grants, but they're able to use that money to really look at the structure of the subsidy and make it more equality and more feasible for parents, and a system that stabilizes childcare and all. So I thought I'd share that.
Thanks, Pamela. Any states, any reps within communities and states that are receiving funds and doing work around shared service or staffed family childcare networks with the stabilization funds? Planet, do you want to jump in and share a little bit while we wait for folks to see if anyone wants to come off mute?
So when I was preparing for this, and I met with our state representatives who are actually family childcare practitioners in their states and leaders, they wanted me to lift up to this group the idea of that there's a difference between the staff networks, which is getting a lot of play, and associations, and both have an important role to play in supporting family childcare and home-based childcare. It's that the staff networks are hopefully trusted community intermediaries, whereas associations are peer-to-peer support that lifts up the setting. So both of them need investment in order to sustain, to be sustainable and to actually support the family childcare setting. And so we have spaces where we're looking at mostly philanthropic dollars, but there's certainly be great state investments in the networks and also associations.
Thank you.
Eric, I'm still looking for that number for you.
And maybe we can circle back to that after we come back from our breakout groups. Jonathan, can we go to the next slide? Great, thanks. So in our breakout groups, you're gonna be randomly assigned in just a moment. You'll be with one of our facilitators today. We're gonna look at which funding streams you're connected to or wanna know more about and share out with your peers. We're gonna investigate how we can support home-based childcare educators to understand their expenses and have them readily available so they can take advantage and be prepared for applying for these different opportunities. We're going to discuss how you're welcoming home-based childcare educators to use their authentic voice to be an influence when you're thinking about planning and implementing these grants. And then we're going to look at how you're facilitating your unregulated or family friend and neighbor providers and educators entrance and progression through quality systems and supports. So with that, we're going to pause the recording